Almost everyone studying for the PTCE pours their time into drug names, but medications are only 35% of that exam. This is one of the areas that actually holds the other 65. Patient safety and quality assurance is 23.75%. And unlike drug names, you do not have to memorize it item by item, because it is all built on a single idea. Here is that idea. Every safety rule in a pharmacy exists to stop one thing, the wrong drug or the wrong dose, reaching a patient. Once you see a rule as an answer to that question, you can usually reason your way to it. There are 3 ways the system does it. Write it so it cannot be misread, separate things that look alike, and double-check the drugs that hurt people when they go wrong. Start with writing it unambiguously. A dose of 1/2 milligram is written 0.5, always a 0 in front of the decimal, because if the point gets smudged or lost, 0.5 becomes 5. That is 10 times the dose. And never a 0 on the end. 5.0 milligrams can be read as 50 if the decimal disappears. So leading 0 always, trailing 0 never. That single sentence is worth several questions. Same logic kills certain abbreviations. Writing a capital U for units is banned because a U can be read as a 0, a 4, or cc. Someone writing 4U of insulin can be read as 40. Write out the word units. Now the second technique, separating what looks alike. Drug names like and are called look-alike sound-alike drugs, completely different medicines, nearly identical on paper. So the fix is to make the difference visible. That is tall man lettering, where you capitalize the part that differs. Prednisone and becomes sown and loan. Your eye catches the capitals even when you are moving fast. Third technique, extra checks on the drugs that do the most harm. Those are high-alert medications, and the classic example is insulin. High alert does not mean used often or dangerous in general. It means an error with this drug is likely to seriously hurt someone, so it gets a second check. Let us work 1. Which is the safest way to write a dose of 1/2 milligram, 0.50 milligrams, 0.50 milligrams, 0.5 milligrams, or 0.5 milligrams? 0.5. Both options starting with a bare decimal point fail the leading 0 rule. And 0.50 fails the trailing 0 rule because that final 0 can turn into a tenfold error. Only one option satisfies both. One more, what is the purpose of tall man lettering? To make labels easier to read at a distance. To emphasize the differing parts of similar names and prevent mix-ups. To indicate a controlled substance. Or to show the drug is high alert. To emphasize the differing parts and prevent mix-ups. Notice that the other 3 are all real pharmacy concepts, just attached to the wrong technique. That is how this exam builds distractors. True statements, wrong pairing. Try one yourself. Which of these is classified as a high-alert medication? Amoxicillin, insulin, or acetaminophen? Pause and decide. Insulin. It is not the most prescribed drug on that list, and it is not the most toxic in a single dose. It is on the list because insulin errors are common and the consequences are severe. That combination is what high alert means. So to recap, patient safety is nearly a quarter of the exam. Every rule answers one question: how do we stop the wrong drug or dose reaching a patient? Leading 0 always, trailing 0 never. Spell out units. Tall man lettering separates look-alike names, and high alert means an error would cause serious harm. Practice these with real PTCB questions. Free at .com/en/pharmacy-tech.